Good evening, everyone, and welcome to today evening's panel discussion on mental health issues related to the LGBTQ plus community. We have an enterprising panel of five members. I will first start by introducing our guests, then I will go to our very own psychiatrists who are part of the panel. My first guest for the evening is Dr. Prasad Raj Dandekar. Dr. Prasad Dandekar is a leading oncologist by profession, and he heads the radiation oncology department at the Sir H. N. Reliance Foundation Hospital. He's also a certified professional coach internationally, and he coaches members of the LGBTQ plus community when it comes to building resilience and other areas. He started an association known as the Health Professionals for Queer Indians, which is an initiative to sensitize healthcare professionals towards members of the community. He's a co-founder of the Teenagers Group, which is a support group for gay men above the age of 50. He, of course, is a most sought after speaker in oncology, LGBTQ plus, and mental health conferences. Most importantly, he's my MBBS batchmate, and it's a pleasure to have him here. Uh, we have with us, just a minute, I have to juggle between two devices. Yeah. We have with us Pallav Patankar, who is currently the director of partnerships of Avigin India Private Limited. Avigin focuses on technology innovations in the healthcare space. He's a director of economics, a diversity hiring organization, and served as the executive board member of the Humsafar Trust and the director of programs there. He's also been a board member of the Asia Pacific Coalition of Male Sexual Health and director of marketing of the Kashish Mumbai International Queer Film Festival. He holds a master's degree in biotechnology and a postgraduate diploma in international business from the reputed SP Jain Institute of Management and Research. He served as a country head in Francophone Africa in the Central African region. He's co-author of a book titled A People Stronger, The Collectivization of MSM and Transgender Groups in India, and co-author of a World Bank study called Charting a Programmatic Roadmap for Sexual Minority Groups in India. He spearheads an initiative called Queer and Political that discusses the queer identity as a political identity. And he's a fellow of the famous five class of Ananta Aspen's Kamal Nayan Bajaj Fellowship and the Aspen Global Leadership. Fun facts, he's a part of a documentary 365 without 367 and a concept film called Urmi, where he's acted as a man in transition. So we have someone who is from the leadership area, business area, and also an actor. Welcome, Pallav, to today's discussion. Uh, 1 minute. My third panelist, who's also our guest here today, is Nishtha. Nishtha Nishant is a young trans woman and a human rights activist. She's professionally a scientific researcher, educator, and a counselor. She's currently working as a scientific assistant at Lilac Insights, Navi Mumbai. She calls herself a survivor of gender-based discrimination, and she's won several awards, especially being the best speaker. She's been invited as a resource person at renowned organizations to speak about special techniques in science and to spread awareness about the LGBTQI plus community. She's guided several students in schools and colleges for their projects and has been volunteering for several social causes. Besides all this, she loves to cycle around the city, travel, cook, dance, and enjoy herself. Well, welcome Nishtha to this panel. It's a pleasure to have you here. Now we have, of course, our two mental health professionals. Dr. Jyoti Shetty, madam, who's with us all the way from Pune. Madam is the professor and head of the department of Psychiatry at the Bharati Vidyapeeth Research Center and Deemed University Medical College, Pune. She has also been part of the Child Psychiatry Committee of IPS 2015-2016, Forensic Psychiatry and Law Subspecialty 2019-2020, 2020-21, and she's currently the co-chairperson of the Indian Psychiatric Society Perinatal Psychiatry Task Force. She is the vice president of the Pune Psychiatric Association, and she's been a past president of the Indian Psychiatric Society Pune branch. Madam has always been doing a lot of work in this area, and I think their department is one of the departments which is friendly with regard to the LGBTQ plus community when people seek mental health issues. And I think they even have a specialized OPD to help these people. So welcome, ma'am, on the show. Uh, my last panelist for today is our very own Dr. Cheryl John, our treasurer of Bombay Psychiatric Society. But beyond that, she's a consultant psychiatrist. She has at the Hiranandani Hospital and Holy Spirit Hospital, Mumbai. She's very active in various areas. She's even working with the church for various initiatives. Most importantly, she's our go-to person. She's always available when we need a resource person or a panelist for any program, and she never says no. So welcome, Cheryl. You're at home, but still we have to introduce you. So welcome to today's panel. What I'm going to do is we have a series of questions, which are general questions, which I think I will run through the panelists. We will start with hearing the views of our guests. So we'll start with Prasad, then Pallav and Nishtha, and then Jyoti and Cheryl. And then, if there are any specific questions I want to direct towards specific people, and the audience would be requested to keep themselves mute. You could type out your answers type out your questions in the chat box, and I would take up those questions as and when in the middle of the panel. So we start with you, Prasad, and one of the things which I wanted to ask you, and I think that's the main crux of our panel discussion here today, is what, according to you, are the main mental health issues noted within persons that belong to the LGBTQI plus community?
So the mental health issues that we see in the LGBTQ community are not very different from what we see in the population. So it's not that the LGBTQ community is at a higher risk of certain mental health issues. We see the same issues such as anxiety, depression, suicidal attempts, and the whole spectrum of it. But what we notice, and we have enough research, unfortunately not from India, but from outside, which shows that the LGBTQ community is at a higher risk of mental health problems. And that is not because they are LGBTQ community members, but that is because they are marginalized and they are discriminated. So it is a part of the minority stress that causes these issues, that there is no space for them to express themselves. So this morning, for example, I was with a friend of mine who's from a smaller town in Mumbai, in Maharashtra, and is being pressurized for marriage by his family members. And he reached out to me saying that, can I take my parents to a psychiatrist to explain them, because he has tried everything that has happened, and this is now causing him sleepless nights, anxiety. He's on has been diagnosed with borderline depression. So otherwise, he's a fit young man. He's 25 years old. He's a very well educated, intelligent man. But just because this is happening to him, he's landing up with mental health issues. So the fundamental issue here is the discrimination and marginalization that the community faces.
Yes. Over to you, Pallav. Yeah, your thoughts.
Yeah, so I have seen the whole space from a programmatic lens because I used to be the director programs of the Humsafar Trust. We ran HIV programs across 5 states at a point in time with multiple community-based organizations. And if you were to, and just to take forth what Dr. Prasad just mentioned, there are two terminologies which we use in programmatic language: is stigma and discrimination. And this whole point of stigma and discrimination is so deeply embedded in the whole psyche of your sexuality as you are growing up. And it starts off early. It's when you're 12, 13 at your most vulnerable stage, and the adolescent stage is vulnerable for everybody. And more so if you are in an environment which is constantly you are exposed to bullying, you're exposed to name calling, and you're exposed to even unfortunately India taking the career decisions at this time. You branch out into your medicine or your engineering, or take career decisions whether you want to take BCom. So I think what happens to a person from the LGBT community is you're constantly under pressure, and this buildup of anxiety, depression, or the feeling of being second or being less is something which kind of actually culminates and breaks into you when you are in your mid 20s and in your late 30s, where it you can't take it anymore, and then it is manifesting itself into depression, and it is and we also notice that because of the stigma and discrimination, and because what we say that the enabling environment is missing, you are not really taking care of yourself. Your health decisions, your personal opinion about taking care of yourself exposes you to various dangers, be it hiv, be it just taking care of your general health, your weight, your diet, your general well-being. And I think so I feel that let's address where this begins very early in our adolescence. And unfortunately, gender sexuality is not something that you can address below 18 without a guardian in our country right now. And that is the time where I feel that we do need to have educators, along with psychiatric health professionals, who are able to be sensitive at this point in time, and kind of nip it in the bud. And I think also a larger social change which is required, because these manifestations, what we are seeing, is what can be stopped at a much earlier stage. So I would like to kind of put that out there.
Sure. Nishta, over to you.
Sure. Thank you so much. Well, I will definitely agree with Pallav and Dr. Prasad, what they have mentioned. We have always learned from our schooling days that the definition of family is restricted to only a man and a woman and their child. If you find someone who is effeminate, especially somebody who is biologically born as a male, we would try to throw them away from the so-called mainstream society. And due to the stigma and the taboo that we are born and brought up with, we end up succumbing to a lot of mental health issues, which most of us are not even aware. People lack information, people lack terminologies or vocabulary to even communicate with some other human being seeking for help. A lot of them get involved into substance use and abuse, specifically in the hope of becoming someone that they want to be, or they try to adjust or accommodate themselves uh, inside, or rather within the binaries, that is the male or a female. Well, all of this is because of the societal pressure, lack of acceptance from their very own families, the place that they belong to. They are forced to leave those places and seek for support from their family of choices. Well, as I mentioned, that there is a lot of awareness that needs to be created, and there's lack of information about the community too. A lot of them experience phobia within the space that they exist. It may not necessarily be the safe space that they want to belong to. It leads to a lot of anxiety issues or disorders, major depression issues as well. And there are a lot of people who attempt or ideate suicide. Well, it is very important to know that people have certain experiences or certain situations force them to push to these ends where they end up taking certain steps which are not very fruitful for them. I feel it is only possible if we start identifying the root cause, educate at the right time instead of waiting for the adult age for people to know about the community. Speak about the issues, speak about people who very much exist as a part of society, and not treat us as strange as queer is defined in the dictionary. Thank you.
Okay, thank you so much. We now move to Dr. Shetty. Ma'am, from your experience in managing people who come to you for help, what would you like to say about mental health issues related to the community?
The mental health issues, what we usually see is depression, anxiety, and since we have a memorandum of understanding with Mr. Khire's organization, so what they usually come for is the primary counseling. They refer for either coming out to their parents or being comfortable with their, their orientation, their identity. We also do a lot of work in terms of gender dysphoria for the gender affirmation interventions. So what we have seen is that obviously, I mean, as studies reported and as all the previous speakers said, there's a lot of depression, there's a lot of anxiety. What we have seen is not so much of substance use disorders, though it's reported in the literature, but definitely depression and also self-harm. So not only ideating, but most of them have had at least one attempt of self-harm, if not more. So that is something that is then, as it was, as the discussion started with, stigma and discrimination being major contributor, obviously one of the primary contributors to it. Apart from that, what happens is, what we see is, like what is noted in literature, that and a member from the LGBT community with mental illness will have a dual sort of alienation. So it is not only in the mental illness, which again has its own stigma in terms of society's acceptance, and it is also being from the minority, sexual minority community. So these
Right.
are two aspects which again come in.
Right. Thank you, ma'am. Cheryl, over to you. Your take. Yeah.
Yeah, I agree with all my previous speakers who mentioned about, like I like what Prasad said about that if you actually look at from the neurological or the brain point of view, the brain of a heterosexual and somebody who belongs to the community is the same. What causes the difference is this added on stressor. So there is something known as a minority stress theory, because of stigma, prejudice, discrimination, violence. The added on stressor causes definitely an increased prevalence of psychiatric disorders in the community. So we definitely see more cases of depression, more cases of anxiety, substance use disorders. Like Nishita said that just to numb yourself or to kind of get rid of the discomfort that you're feeling, you don't know how to reach out for help. A number of suicidal attempts, I mean, it's almost 4 times as compared to the general population. Another thing that we notice is domestic violence and being victims of that and the aftermath of the violence. So, violence in the family, sometimes violence in intimate partner relationships, and the implications of that on mental health. So, this is what we see. We definitely see the increase in these cases.
Sure. I now move back to Prasad, and we move from this introduction to something which is very relevant, because I think I've had a number of patients that have very often come to me and spoken to me about coming out and how important it is. And so I would, want to ask you, Prasad, that the first thing is that, you know, this could be your personal take. You could give us a theoretical take, whatever you like. How important is coming out? One, and if you do come out, people always tell me, so what would be the right time? Is there a particular way? Are there steps to follow? So your take. Yeah.
So I feel coming out is important, but it is an absolutely individual decision to come out. First of all, this entire concept of coming out is almost inhuman. That you have to hide yourself in the closet, and then you have to fight it with yourself and the entire world outside to then gradually try to come out. I personally feel my personal take is that coming out is a huge benefit. It set me free. It literally set me free when I came out. My first coming out was when I was hardly 16 years old, when I came out to my closest friend, and his unconditional acceptance is what made me today. I'm here in this panel probably because he just accepted me for who I am, because it just set me free. However, saying that, you have to be very careful when you're coming out, and as a mental health professional, you need to be careful when you're advising people to come out. It is important to consider, is the time right? Are you financially independent? Suppose if the family throws you out of the house, what are you going to do? Are you financially independent? Do you have any allies in the family? You need to have a network of people who will hold you if you fall down. So whether they could be family members, your cousins, your siblings, they could be close friends, uncles, aunts, whatever. Thirdly, whom are you trying to come out to? Are they ready to hear that? Say, for example, if you're trying to come out to your parents and you feel they are at an absolute homophobia end, then maybe it is not the right time to come out. You need to sort of work on them, soften them up, and then come out. And also, you need to have a support structure built for people whom you're coming out to. Say, for example, if you're coming out to your parents and you expect something to go wrong, then you need to have, some family members who will support you, maybe a counselor, maybe a psychiatrist on hold, just in case if there is a problem. So while coming out is useful and I recommend it, but it is a highly individualistic decision, And do remember that coming out is not one day or one time. We keep coming out throughout our life to different people. So don't rush into it. Think and then plan and come out. A plan coming out is infinitely better than an impromptu coming out.
Right. Pallav, your thoughts.
So I couldn't agree more than what Dr. Prasad just said. I mean, everything applies. I I have seen while my at my work my at my Hamsafar, I've seen coming out which have been good, and I've seen people bloom in the process of coming out, and I have seen disasters also. In the sense where, like Prasad said, if the coming out is not planned, and if it is a cry for help with the family when the family is not ready for it, then there has been a huge crisis at the family level, where then you have to involve family counseling, you have to bring in the mother, which is not the same as some where you have worked it out. But I think before coming out, I think the first step is coming out to yourself. I mean, have you accepted yourself and your own sexuality? I mean, and you need to be really comfortable in your own skin, and you need to say that this is who I am. I mean, and just like Prasad spoke about 16, I think I was at the same age, around 16, 17, 18. It took me 2 years to actually say and accept the fact that I was gay. I mean, and this I'm talking in the 90s, when there was very little discourse. I think today, the good thing is that there is material and there is enough of a conversation which is happening, which is a good thing. But way back in the 90s, we didn't have many resources. I think Ashok is out there, and Ashok and Bombay Dost in the 90s were the only material available to somebody like me at that point in time to actually go to. And having said that, a lot of people have come and asked me, should I come out in my office? Today we have diversity and inclusion agendas, and organizations and companies doing this whole LGBT support thing. And people will say, oh, should I come out to my colleagues, and should I come out to my workplace? And I'm like, listen, it is not as if you're going to come out at your workplace and go back into the closet tomorrow because you change your company or the organization. Once you're out to the industry and you're out to everybody, and it is not like you can decide to go back in the closet tomorrow. So the planning and the need for being, knowing that it is an irreversible step needs to be kept very clear in your head. You need a very good support structure, and here, the whole how what is your support structure becomes extremely essential. Either it's your family, it's your set of friends, it could even be your colleagues who are there to kind of take up more. And I think that preparation and creating of that support structure becomes essential. And in the community, we sometimes say my family, my support family, or my alternate family. It is your set of LGBT, your allies, and everyone who is there to hold your hand and support you if anything goes wrong. And that is extremely essential, really.
Right. Nishtha, your take.
Well, I would definitely second Dr. Prasad as well as Pallav to what they have mentioned, but I would want to add certain points. Uh, can we ask everyone to go on mute, please?
Priyanka, just check. Yeah.
Yes, I'll unmute 1 second.
Sure.
I know.
Just mute.
Chicken,
Yeah.
I know grilled chicken, chicken gravy, and all.
Yeah, I'm hungry now. Mr. Patkar is cooking tonight chicken.
Uh,
Okay.
That was with eggs. I make with.
Okay.
yeah.
So I would like to add that coming out would be a different experience for different individuals. Uh, since I identify myself as a transgender person, and I was not very well equipped with the queer community and the terminologies, I was coming out at different times and different phases. And now, when I connect to those days, I can also connect to the current scenario where people identify themselves as gender fluid or queer or non binary for that matter. So it is very important for one to first understand a little more about the queer community, because when you come out of the closet to maybe your loved ones, there may be certain questions which would be raised, and one needs to know a little to address those questions in an appropriate way. If you do not find yourself to be capable enough to explain about the queer community, see to it that you have somebody from the community along with you who could be your ally and who could be your family of choice, and help you address those questions in an appropriate way. I also recommend to ensure that you create a safe space for yourself. Well, of course, with addition to your financial independency, identifying your family of choice, you may be capable of identifying a safe space for you. But ensure that you first accept yourself, like Pallav mentioned, and then come out to whoever you want to. Thank you.
Yeah. Dr. Shetty, madam, this question is more as a psychiatrist, and I'm asking you this because we very often get people who come to us and say that, I want to disclose to my parents, or I want to disclose to my family members, and they would want to do it in a session with you being,
Yeah,
present, because they feel a little secure and they feel a little more
true,
confident. So
true.
in such cases, I mean, where they want to do it, I mean, what is the kind of approach that, you would follow? Yeah.
Yeah. In fact, we get quite a few individuals who do come for this prime reason, actually. They are probably very comfortable with their identity, with their orientation. They have probably also come out to their friends, actually, so they have shared their orientation. It's just with the immediate family, I think, becomes the last sometimes to know, especially in our society. And more than 2 years back, I think it was even worse, actually. So what we get is, like, they would probably come initially with a friend and speak about how one partner has come out to the family and the other partner has not, and how to do it, because the plans may be of probably moving in together, and then uh, being seen as friends, just cohabiting, but then obviously wanting to be much more transparent about the relationship. So this happens quite often. So what we usually do is, what I do personally is, like, we ask them to sort of inform us whether they've come out with one of their family members, probably a sibling, maybe a cousin who they are very close to, who may be of the similar age. It helps because the relationship also, depending on how close they are, if they've come out to one of their relatives, then probably having that individual also coming with the parents, because parents, sometimes probably the mother or the father, probably are the toughest ones to break, or come out to. So to even sort of come and tell them, probably there will be a lot of inhibitions. So we ask them to come. In fact, we initially, what I do is, I ask them to come with that cousin or the sibling who they are comfortable with, so that we can go out and go through a process of how to go about inviting or asking the parents to come. So it is always preferable if they do the job by themselves, probably, I mean, if they're comfortable, probably, with the cousin, or the cousin says that, okay, this is something that I can also address with initially with the parents. That is a one step. Otherwise, what we do is, we have them all come to the clinic, and then open up the conversation about how they see, because what I found is that most parents, at least one of them, may have an inkling. They may not actually talk about it, or it's something that is swept under the carpet, but they may have an inkling about it, though they don't want to address it overtly. So usually it is, individually, when I see the one of the parents, I always ask them what their opinion is, how they see it, and what is it that they think that the individual has come to talk about. And then we bring up the conversation about, generally speaking, about what is identity, what is orientation. And I always invite, actually, the individual, if they would like to talk, because that is something, because ultimately they have to go to the same house, and live with that family member. So then, if they feel safer in the clinic with us around, but if they wish to talk, we ask them to talk, of course. And with the, if there's another family member who's obviously the ally, being included in that conversation, so they can start. And then after some time, what we have seen, I mean, what I see, I think it's something that all of us see, actually, in the clinic. One or the other parent will probably have a lot of distress, initial, a lot of denial. And that when we identify that that is the person who needs to, sort of probably have some more time independently, individually. And that is what I do. I, sort of allow them to take some time, then come back alone and speak to them at length about what their queries are, what their understanding is. and of course allow them to also ventilate their own distress, because that is something that we have to do, handhold with
Right.
one or the other parent.
Right. Well, thank you. Cheryl, anything you'd like to add? And then I have a question from the audience also for you. Yeah.
So, no, I think that everybody is kind of, covered, like we said. But the most important thing I really like what Prasad said is about self awareness, right? Because that's the most important coming out, especially as you're crossing the adolescent age. That confusion, why am I feeling this way? Because you're living in a heterosexual normal world, and you're kind of getting confused. Why am I feeling this way? Is this normal? All the confusion you're feeling inside, and the moment you acknowledge, become aware, you come out yourself, I think that sets you free. And you integrate all the different parts of yourself. And this coming out definitely is a long process. I see a lot of my club patients who say that, they prefer to come out only to their community, that is LGBTQ plus community. They do not want to come out to the family, and that's a good support system. I think there may be a lot of parents who are listening, and I really feel that, as parents of young children, we always want to give them that, self confidence, build up their self esteem as a parent. And when my child is comfortable as an individual, he should also be comfortable, irrespective of his sexual orientation, to come back to me and talk to me about their problems. So, as parents, we really need to, be there for our children, irrespective of the sexual orientation. Yeah, so that's what I want.
Yes. Well, this is a question which I will address to you now, Cheryl, and so it will not be that we're always coming to you last. And then, of course, Pallav, I would want your take also on this. Someone has asked, is there something we can do to normalize being gay? Because I'm open to my immediate family and friends, but it kills me that I can't be open to my relatives. And digitally, I have taken steps to open out, but I hope they go well. But I'm very scared about my parents having saying something after I post something, and I'm mentally stressed. So Cheryl, first your take, and then Pallava. Yeah.
This is a very common narrative,
Yeah.
right? And I see so many of, like I said, I recently there was this gentleman I was seeing online, and he was talking about, like, his parents knew they're from a very elite and, educated family, so they accepted all that, they accept his partner and everything. But when it comes to family, they're like, okay, ab shadi karo, right? Because you can do what you want, but you just get married so that our relatives don't find out about this orientation. And I think that what we as a community, or this is a societal problem, right? It's not an individual problem. We have to change this conformity that we put only as heterosexual as normal, and kind of work hard in making people realize there are people of different orientations, gender, fluidity, which is another girl who came to me and said, I myself am not sure, and how do I talk to my family? So that is, I think, our role as a society to normalize different orientations. And we all need to work really hard, starting right from school. I think when we address young children in school and we talk about, sex only as boy and girl, we need to kind of make them aware about the other orientations too. So we start early, and I think by the time the generations build up, we will see a society where everything is normal.
Right. Yes, Pallav.
Yeah, so okay, let's start with the using the term normalizing. I mean, first of all,
Yeah.
I don't understand it anymore,
Yeah.
but like I think I'll give a little bit of a personal perspective. I was coming from a very corporate space, and I was out to family. Everything was fine and hunky dory, but of course, my mother, and she was a single mother raising me. Was not of the opinion that I should be going and talking about it to everyone, because obviously all parents say they won't understand it the way I do. And of course, I was then the director programs at Hamsafar, and you have to go into the media and speak and talk. In Section 377, a lot of issues were going around. So I used to end up being on television. And I think that was the biggest normalization, because I didn't bother going and telling my extended set of relatives anything about it. They saw me on TV speaking about it, and I was speaking about it very seriously with facts, figures, and a matter of factly that when we met in person, I really did not have to come out to them as gay. They said, hey, we saw you that day, probably talking about it. And if to extend it to what you're saying, they are seeing my posts on Facebook and that I support, the queer community. And sometimes they say, I like the work that you're doing for these people. And I usually say, these people is me. That's who I am. I mean, like, I'm not working for these people, and you own up and you actually kind of, it is interesting how I've really not needed to come out to people within the building that I live in or my extended set of families, because I normalized it for them. I kind of started speaking about my work or what I do or what I feel in a very normal way, that I did not make it, hush, who, by the way, I am gay. I normalized it, and that's why it didn't become dirty. It becomes dirty when you want to hide it and feel dirty about it. And that's why the first thing which I said is, are you comfortable with yourself about who you are? Because then the way you put it forth is a matter of fact, yeah, this is who I am. And I think people appreciate the fact that you're being your authentic self and not hiding behind. Yeah, I'm
Yeah,
done.
yes, okay. Now I have two things. One is, of course, we have a wonderful panel here. You all have all been very wonderful so far. There's a request from the audience that we should have a panel discussion of this caliber in Hindi as well. So we will definitely have it in the future, and I plan to have all of you back again, but the same thing, but in Hindi. So I will definitely do this in my tenure as Bombay Psychiatric Society president. That's a promise. Now, a question for Jyoti Shetty ma'am and Prasad. Uh, we've had a question that very often same-sex couples come in for counseling where one plays a male role and one plays a female role. Are there any general pointers when it comes to counseling, such couples in an office-based practice? So, what should we do? Should we not do? Jyoti ma'am first and
Yeah,
then Prasad.
okay,
Yeah, yeah.
fine. I've had such a couple, and then what I have found, I mean, when they come, most of the issues are the same. I mean, if it is an interpersonal conflict that they have, irrespective of who's taking the role of what, which gender in that sense, it does not really matter. It becomes like, it could be very frankly, sometimes it is, very mundane stuff related to roles, whether it's in the kitchen or whether it is something that is not done, and then that just builds up. So a lot of issues that come are mundane day-to-day things, and that may just build up, as I said, largely not to do with the role that they take. I mean, so then probably, the sexual activity and the role they take in bed really doesn't come into it. It could be something to do with, personal hygiene, or something to do with very, normal. I think even any heteronormative couple would probably also be facing these issues. So in that sense, I would say that it is, the counseling would go on the same lines. It would be
Right.
about, the aggression and the, allow one individual. In fact, you feel that one individual is having much of a more of a stress, probably having some individual sessions with that individual anyway. But as such, I do not, really see too much of a difference in terms of, as you said, the positions that
Sure.
they take.
Sure. Prasad.
So this is a very common question that we get, me and my partner. So which one of you is female? And my answer to that, it depends on which room we are in the house. Because this heteronormative thing of the woman should cook and woman should, the person who is taking a receptive position in the sexual act is the woman, is again a heteronormative thing. um, the way I look at it is, there are no roles taken here, there are no women in this relationship, and that is the whole point. You may ascribe certain activities that you do to a certain gender uh, role, and that's about it. That, like, I like cooking and I may like doing something else, and I may like, so it doesn't work that way. And as Dr. Shetty said, it is finally boiling down to two individuals living together and trying not to kill each other. It really boils down to that. So I have had counseling sessions with various psychiatrist counselors. I mean, I've been with my partner for 17 years and we are still alive. So you can imagine the amount of work that goes in, and the issues are the same. Of course, the only thing that is essential in this from mental health professional perspective is that the mental health professional needs to be aware of what we are getting into. I have had one very strange incident where me and my partner went to a particular psychiatrist. I think this was around 8 or 10 years ago, and she had absolutely no idea what we were talking about. And she was a very sweet girl. She said, you know, Dr. Prasad, I have no idea. So me and my partner actually sat down there and educated her for 2 hours about LGBT community while we had actually gone her to help. So that is an important thing, and initiatives such as this that the psychiatric societies across India are now taking are achieving that. That we are educating the mental health professionals to sensitize to these issues. But I totally agree with Dr. Shetty. It finally comes down to two people coming together.
Right. Nishta, there's a question for you from the audience, which I'll ask, and I think it's a very clear question that, and I'll give you my personal take on this also. Why are people hostile? When they see people with pronouns, why are they reluctant in using pronouns, for that matter? And since you've done a lot of work in the area of stigma and overcoming stigma rather and discrimination, your take? Yeah.
Well, I genuinely believe that we are living in a society where we are already preconditioned with addressing people with gender pronouns that belong to the gender binaries, that is male and female. So if we see a woman or somebody who is dressed in a women wear, we would address them as she or her, or the otherwise we would say he or him. And we have never been equipped with addressing people with gender neutral pronouns like they or them. And it really matters to the person who identifies themselves as genderqueer or non-binary that the pronouns that they want have to be used or addressed. It is out of love and respect that one would do. It may not necessarily be that the person wants to identify themselves within the gender binaries. So it is very much important to ask someone if they appear to be or they are queer, or if they want to have any specific preferences in terms of being addressed with their desired name or with their desired gender pronouns. It is our responsibility, or rather the onus is on us to respect and address them with the preferred name and the pronouns. Well, it wasn't very easy while I was transitioning for people to understand the importance of gender pronouns that were supposed to be used for me. But it was my responsibility to ensure that I would educate them, make them understand that how these mental uh, health issues arise due to inappropriate usage of gender pronouns or misgendering or miscalling me by my dead name or my previous name. And it is no good for me. And there might be implications which may not be good for anyone. So helping people know about what is my requirement in the beginning was my responsibility. By now, people are equipped with understanding things, but there would be one person out of the many who would still not adapt to the change. For such people, I believe that giving them their own space away from me, that is distancing from them, is healthier for my own mental health. And I still focus on this particular aspect that if somebody doesn't know about our identity, or if somebody doesn't know about our gender pronouns, it's always better to ask, educate, and keep them well informed so that we do not have any bitter experiences moving forward when there is any interaction, or when there is any communication between the two of us. Yeah.
Thank you so much. I will just add here. I always remember when this whole issue, when I was new to working with the LGBTQ plus community, I had no idea about pronouns and the use of pronouns. And I remember I went in for a seminar, and somebody asked me, sir, what are your preferred pronouns? And I really didn't know what to say. I mean, it was, and I actually had to tell him that I'm sorry, I'm not aware. So they felt, no, but I mean, what would you like to be? And for me, I mean, it was like, it's obviously he. And I didn't know that, and then it was someone who explained to me over there, and that's when I learned. And now when I meet people, I often ask them, how would you like me to say, address you, or what would you want me to say? And that's how sensitization sort of came in. Someone has asked us whether we should have a mandatory training session for doctors in medical colleges to make them understand how to address these issues. I think we should. I think Prasad and his team had done a session like this at Sion Hospital for medical students and medical doctors. And I think in the post COVID scenario, once we get back to physical meetings, we'll definitely want to do this. Even now in the online setting, we can definitely probably do this. So there would
We
not be
have
an issue.
been.
Yes, we have been
Avinash,
doing
can
it.
I
We
just
have
add
been doing.
Yes,
something
yes,
quickly?
please.
Yeah, so the education of doctors is very important, and we realized a few years ago. I personally faced a horrific homophobic incidents from a colleague of mine whom I knew for many, many years, and he abused me online publicly, and that really broke me down. It took me many days to recover from it, and that is what led to formation of the health professional for queer Indians. And Dr. Avinash is being very modest here, but let me remind him that Dr. Avinash and Dr. Kersi Chawda were the first people who supported this cause, and we held our first conference around 3 years ago, which had more than 750 registrations in just like 2 days. And since then, we have conducted many conferences across cities, and we have in fact utilized the pandemic in a way that now I'm conducting many online webinars. So I conducted recently in this Pride Month itself. I did it with AIMS Bhubaneswar. Next week is Stanley Hospital, Stanley College, Chennai, and then is one college in Meerut. So we are doing that, and the amount of enthusiasm that the medical students have is really encouraging. So to the psychiatric community, if we can organize more of these sessions, I think we will be paving way in a long-term basis for non-discrimination.
Yes. Madam, you wanted to add something, Doctor?
Yeah,
Yeah,
I
yeah.
wanted to add that not only have we been doing that for the past 2 3 years at the undergraduate level, and of course postgraduate level we do anyway. But the CBME, that is, the competence-based medical education system that has come in the past 2 years, it has an ADCOM model. So that is about attitudes, ethics, and communication. So apart from persons with disabilities and how to deal with them, LGBT community, minorities, sexual minorities, about talking to them is something that is also included in the curriculum. So then, of course, I don't know how many colleges actually at an individual level who do it in a much more intensive way, but then it is something that allows us scope to include it. So it's something that starts from the first year onwards, in front from the foundation, the course, which is the first month of MBBS.
Yeah. Well,
Dr. D'Souza, I
yes.
just wanted to ask, since we are on this thing of education, I yet wanted to highlight that there are instances of convergence therapies which we get from time to time in
Yes.
smaller towns, not in main cities. And I do not know whether there can be any process within your setups to address those issues whenever it happens.
Yes, no, I will, because there's a question even asked that very often we visit a psychiatrist or a psychologist with a confusion about our sexual orientation, and they advise us to get married even after telling them that all our sexual milestones are towards the same sex. Now, sadly, well, I would say, I mean, you're speaking for myself more, and even as the president of Bombay Psychiatric Society, well, I think a large number of our psychiatrists in Bombay are very sensitized and positive towards, though of course we will always have some people who aren't aware and they really don't know, or they're probably too old in their thinking. These things do happen. It does happen in smaller towns as well. It happens in metros as well, leave alone smaller towns. So and what I would advise people attending this program is that we have Dr. Jyoti here, we have Dr. Cheryl here, we have all the members of our executive committee of Bombay Psychiatric Society. You can look us up on the website. I'm there, Prasad is there. So you need any kind of help, just contact us and we'll put you with the right people. And that's what I think health professionals for queer Indians also does. It puts you with people who are sensitized, so you will not face this problem. Even we have counselors and therapists who are sensitized, so you would not face this problem. Another thing also I would advise all of you is, before you consult a psychiatrist, please call up the psychiatrist and ask him, are you comfortable and do you handle these issues? Because if he is not equipped or he doesn't handle these issues, you might as well go to a professional who can handle them rather than face, the negativity that you sometimes face when you go here. So, but we will as a society take it up and try and, sensitize more and more mental health professionals towards this. Definitely. My question now is to Prasad and, of course, to Nishta and Cheryl, all three of you. Uh, with regard to elderly members of the community, and what are the mental health issues? Are there any mental health issues which are specific to them?
So one of the initiatives that I run with Ashok Rao Kavi is called Teenagers, which is basically like senior teenagers. This is a support group for gay men above the age of 50, and the stories that one sees there are quite sometimes heartbreaking. You know, a few months ago, one of the gentlemen who's in his mid 70s told me, Prasad, I have wasted my life. This is somebody who got married at an early age because of 50 years ago he got married, and he has lived with depression and anxiety and guilt and all of that throughout his life. So we do see a lot of mental health issues in these people's life because they're not able to express themselves, and not only that they are not able to express themselves, but they actually have to express what they are not. So they have to pretend that they're a family man, or they have to make babies come what may, and prove that they are heterosexual or man, and that leads to a lot of problems. Many of them have homosexual partners, and then the relationship becomes very complex. If they come out by mistake, or if somebody outs them, that leads to a lot of disasters on family level, financial level, before 377, even at a legal level. So blackmailing is a huge issue. Probably it has come down now because of the 377 gone, but before that it was a major issue. Some young man would meet you on one of the apps, then come home and then threaten you that he will blackmail you and out you to your employer or to your family, to your wife. So it's a difficult life, and we're trying to do whatever we can from teenagers' point of view.
Yeah.
Having said that, even today, younger people in their 20s who are completely aware of their sexuality are getting married to women, even today. I have people who are in their 30s and 40s are getting married to women because they can't deal with the loneliness that comes with. They said, I don't mind, but I just need somebody in the house, otherwise I'll kill myself. So it's a very complex issue, and I don't know. It will take a while for us to, as a society, to stabilize.
Yeah. Shetty ma'am, your thought. Sorry, Cheryl, your thoughts.
Yeah, so if you're looking from the psychiatric point of view, a lot of research says that the incidence of mental health issues, if you're talking particularly to the LGBTQI plus community, is seen in less than 35 years of age, and then the second age group is above 55 years of age. And it completely resonates with what Dr. Prasad is saying, right? That you have lived so many years. Um, you know, uh, Not identifying with who you are. As you grow older, there is a lot of loneliness, isolation, a lot of remorse and regret for what life could have been. Um, Again, the fear of victimization is huge because it's such a hidden life, and then a lot of people threatening, a lot of memory and dementia changes that we see sometimes because of the chronic stress has been there for a very long period of time. Sometimes the neurodegeneration starts earlier. So definitely a lot of mental health issues more in above 55, and I think these are the reasons for that.
Okay, Nishta, um, any thoughts on elderly? Yeah.
Sure. So, having not been allowed to be who they are, has a lot of effect on their mental health. While they progress and while they want to be the true version of themselves, a lot of people end up using digital world which is available nowadays. A lot of them end up joining dating apps for that matter, which connects them to people maybe of similar age or younger age, who tend to take undue advantage of their age particularly, and try to exploit them, be it sexually or financially. It also leads to a lot of anxiety, depression, and many more other issues related to mental health. I feel it is very important to reach out to mental health professionals, trust people around, and share rather than allowing things to happen. Thank you.
Right. Thank you. Well, Pallav, I have a question for you. It's a more of a social issue, and then I would ask Jyoti ma'am to give her take on this also. Uh, Someone has written that, because of social pressures, they've had to get married, though they didn't want to, and they are now struggling, of course, in that relationship which they are in. And also at the same time, you can also have a person who is married, but he has now come to understand his sexual orientation, and he's of course involved with a partner, and there's a guilt of cheating on his wife. Now, what would be your advice, of course, as someone who has worked with members at a program level, and then of course, Jyoti ma'am? Yeah.
I have dealt with several such situations which have come to me, and in most cases, we look at it from a very holistic perspective. Now, just because I'm from the LGBT community doesn't mean that I'm going to see it from the gay man's eyes. I feel that here there are two individuals and their lives at stake. I have to even see it from the woman's point of view, and the fact that she is in a marriage where probably there is, something that has come in her life which she was unaware of. So you have to be fair in that whole situation. And usually we have sat with the gay man and had to explain to the gay man that, listen, not only is this not fair to you, but it is not fair to the woman. And if we are it would so we usually encouraged that if you want to reduce that guilt is to start initiating that conversation. Sometimes when you are married, you may not be aware of your own sexuality, and that happens very often. Not everybody is aware about their sexuality when they are 16, 17. The person has also come and said, I did not know until my first intimate encounter that it was actually men that I liked. And sometimes they refer to their initial sexual exploits with men in school or college as something that was experiments. They did not realize that it was their sexuality, and they feel that after marriage they realize that no, they're actually gay. In most cases, we've asked people to address it with the wife in the right way, and usually then, of course, like Prasad said, the legal point comes in. If they want to continue that marriage, they do not wish to continue that marriage, and if that marriage has to go its separate ways, then what are the rights of the woman as well in that whole space? And that is an important conversation as well. A lot of times we've had situations where the husband has, I mean, the man has come along with his lover and he says, can I just have this, I want to have a divorce with my wife, but please tell me a way how I can cut this short and have her thrown out without me having to pay anything. And we are like, that's not something that's just okay.
Right.
Please understand that she is also suffering because of the stigma discrimination which is heaped on a gay man and the sexuality, that it's not just the gay men who end up getting affected. It is a larger society which gets affected because this person is in the closet. And that is one of the reasons that if we were to reduce stigma and discrimination, it would have been good for the gay man as well as this woman who would have not been in this marriage. And we need to explain this to this individual and say that please do the right thing in ensuring that she has a future and a life too, if this marriage is not going to happen. But then that happens to be a counseling as a community member to my community as well in doing the right thing. It's not just about just saying, okay, now go ahead. So I think these are not very easy conversations. They become very case specific, depending on the situation, even depending upon the education level of the woman, whether she's financially independent or dependent on the husband. And they have, so usually we also have a lawyer in the room, a human rights lawyer, who also explains to this. So I feel then it goes on a case to case basis. But on the whole, as a community, we are not here to, at the cost of my rights, to step on someone else's rights. That's not the way human rights work. We really need to kind of take it in a stepwise way.
Yeah.
Yeah, we have
Yeah.
had couples like this where, I mean, the male being a bisexual coming out very late, I mean, up two children to the wife. Of course, the wife had clinical depression. So the index patient was the wife who was brought to us, and then it was subsequent interview that revealed what was happening. But here again, it is not, they were very clear that they wanted to stay together, irrespective of what the sexual orientation of the husband was. Both of them desired to stay together. And though she was I mean, both were from a very upper socioeconomic group. They were seen as the ideal couple, in fact, for the first 10, 15 years of their married life. So there were a lot of societal compulsions also. I'm just giving a sort of a case, like, to elaborate. So in such a case, obviously we need to deal with the distressed spouses, anxiety, depression. Uh, Over time, they do come to deal with the reality of the situation, that there's always going to be grief over the loss of the relationship, as it was, or as they thought it was in the initial part of the marriage. But I think it is about forging another bond with the individual concerned. So it is almost like, like, at some stage, even if it is not, it may or may not be a sexual relationship, but it could be at least a platonic relationship where they can accept each other as individuals, who are cohabiting or living together for whatever reasons. I mean, it could be for the children or whatever. So I think that is the process that we as mental health professionals should actually support them in. So without coming off, like, it could be very easy for us to say that, why don't you all separate, and encourage them to actually lead a much more, what we would probably see as, more fulfilling lives as independent individuals. Like in this case, the lady was educated and could have lived alone also. So it was not that, that she was very dependent. But I think it is about we looking at what the couple as a unit needs also. So I think we need to support them in that decision and treat the distress that is there, because in this case, as I said, it was the husband who was distressed, that the wife was distressed. I mean, he was not, he was pretty comfortable with what he was. So
Yeah.
those are the issues that we have to take at an individual level.
Right. Well,
I mean,
yeah, yes, yes, Prasad.
can I just add something
Yeah,
quickly?
yeah,
I have heard of many cases where such a case goes to a mental health professional, or sometimes even a lawyer, and then they, go to a mental marriage counselor and all. Um, the typical thing that happens is that a gay man is married to a woman, so woman is the victim. And many times people have told me stories where the mental health professional was actually very unkind to the gay man. I've conducted a study where I took very detailed, in depth interviews of around, I think, 11 or 12 married gay men, and it was heartbreaking. The summary is that both of them are victims of this marriage. A gay man has been possibly forced into that marriage or was unaware. There are people who told me, I didn't even know that not getting married is an option. you know so without considering one person as a victim, as Dr. Jyoti said, we and Pallav said, that we have to look at it from a whole relationship point of view, societal aspect, and work on it from their both points of.
yeah. Well, I will now come to a very important question, which I think is important. Someone has mentioned about us having these sessions in schools. Cheryl mentioned it earlier. Jyoti ma'am mentioned it. Yes, we should have it. I remember when we, myself and Dr. Chawda and others, we decided to have these sessions. We were met with a little bit of reluctance, but then we incorporated it into the sex education session and took it. And in fact, the ninth and 10th standard students knew far more about LGBTQ plus and all the terminologies than probably we thought they would know. So that was something which is there. Now this is a question which I will of course address to Cheryl and Nishtha. And since Nishtha works with a lot of students and Cheryl also does a lot of school work in schools, very often we get a 9th standard or a 10th standard or maybe a 11th standard boy or girl that comes to us and says that, I think I am either gay, or I'm either lesbian, or I'm queer, or I'm having this. So now, generally, the premise as mental health professionals we've always been taught is that yes, we don't discourage them, we don't sort of say anything negative, but we tell them, let your sexuality develop, let's you cross 18, 19, 20, see how it goes, and then whatever is your orientation, go with that. That's what we generally tell. We do not diagnose an orientation or label an orientation at 14, 15, and 16. So the key issue is, if an adolescent comes to us with the fact that I believe my orientation is so and so, what would be our advice? One, you first, Cheryl, as a mental health professional, and then Nishta in general. Yeah. Yeah.
Um, I agree with what you're saying, Avinash. And actually, I think in the recent, so many years of practice, in the recent 2 or 3 years, I've had so many adolescents coming up, ninth and 10th graders who say that, and they'll come up to their families, and the families, I think I'm bisexual. And when we kind of try to probe, and like there was this one individual who said that I'm gender fluid. When many of them come up with the idea of being bisexual, uh, and we really have to probe that over a period of time. So I tell them that we understand this, and from what are you uh, feeling this is your orientation, because you have not had sexual encounters, you have not had an opportunity to explore your sexual orientation. Many a times it's also unfortunately because of social media that they hear some things and sometimes they feel it's cool to be bisexual, and it actually it's not that is that their real orientation, or it's cool to say that I'm gender fluid, because I think at this adolescent age group a lot of attention from your peers, saying something that makes you stand out. So these things are also factors that we have to look into when a person comes and says my sexual orientation is different from being heterosexual. So we have to give them time and say I'm here for you. I'm here to kind of guide you and help you through this orientation. Let's not label ourselves now. Let's see where this is going as we grow older, and then we kind of decide what do we want to do about it.
Yeah. Nishta.
Well, I agree with Dr. Cheryl. I have a different approach to this particular situation where I identified having students in my classroom who would come and discreetly share their experiences of being a queer individual. My approach would be being available to them whenever they need, be it on messages or on calls or however in my best capabilities, whatever support I could provide to them. Be there and just listen to them. It makes a difference for queer individuals to share how they are feeling, because their experiences are not something which somebody else who they would know have had in their lives. So being available and giving a listening ear works. And as they progress, they start realizing that there is a way through which they could explore. Well, it could be possible digitally, by knowing about queer community, or there's a lot of content available. Also, they try to relate and they try to understand whether is this something that I want, or can this be something else. So to discuss, they need somebody who belongs to the community. When I say that, it is important because their lived experience also contributes. Being a trans person, a lot of people approach me saying that, no, I think I'm a trans person. Well, I tell them only one thing: nobody else can decide things for you. You have to decide things. So give it time, give time to yourself, and try to understand that there's nothing wrong in being the authentic self of yourself. But take time. There might be a possibility that you might think that you are something else than what you think at this moment. Well, like I mentioned, gender is fluid, and a lot of people may feel that this is the thing. So they would say, no, this is the thing. But after some time, they may say, no, this is not my thing. So until and unless we don't understand our own self, we don't accept ourselves completely, we just don't have to jump onto conclusion, is something which I recommend people. And once they are comfortable within their own skin, they are just out and open to the world, and comfortably they lead the world as they want to.
Yeah.
Thank you.
Pallav, your hand is raised. You wanted to,
Yeah, that's
yeah,
right.
yeah,
I just said I wanted to bring out some programmatic work which we have done with schools. Now, like you all mentioned, it's difficult to actually address sexuality and gender issues sometimes with children because schools are uncomfortable with that, and rightly so. Sometimes below 18, they don't want to get into problems with the parents of the children. But what we realized was some of the NGOs were yet seeing bullying and same sex behavior amongst the slum children or even within the schools. So one of the ways of addressing that was at least sensitizing the board of the school as well as the teachers and the counselors within the schools who had no idea about how to handle gender related issues or same sex related issues. So in case a case does arise in school, or a issue of bullying or something happens in school, or some sexual bullying happens in school, the school counselor and the teachers, the principals or the board is equipped to handle that situation sensitively,
right.
rather than being a blank state. So I think even as a starter, I think the ability to at least train the teachers and the counselors and the board of the schools is something that I feel the psychiatry societies can do as a program in the future.
Correct. Well, I that now brings me to my last round of questions, and these are going to be questions addressed to each of y'all. I would request you all to spend not more than 1 minute answering these questions because it's more like a breezer round of questions. I'll start with you, Jyoti, madam. I mean, we've always been addressing the issue with regard to gay men who are, with their problems. What do you think are the psychological issues faced by lesbian women?
One is that we don't get so many lesbian women who seek out help. What mostly who I've seen is like we get them as partners of transgenders and the ones who with gender dysphoria who are coming for gender affirmation intervention. So the partners will come with them. They have been in a lesbian relationship, and then the one partner has obviously had gender dysphoria for some time and then decides to sort of go through the intervention, and usually it's young adults. So but then primarily, so and what I've seen is that most of these partners are very quiet. They would not probably be talking much. They will be very supportive, but they'll be in the background. So it is primarily the individual with the gender dysphoria who will be actually sitting and talking. But apart from that, yes, what we have seen, I mean, the few patients, I mean, who have come with depression, not so much of substance use, but depression, yes, self harm, at least ideation with thing. I think what happens is with lesbians, uh, maybe they, because of a society, they could get married, they're forced into marriage, they probably come to become aware of themselves pretty late. Now, of course, there are lots of adolescents who are coming out, they are aware, they're much more aware. In fact, what we have seen is even in our undergraduate training programs, the first years always know all the terms and all the
Right,
terminologies. We don't
right.
need to really educate them much,
Sure.
while the PGs are the ones who need the education,
Correct, correct.
at least 10 years ahead.
Yeah, yeah, right, ma'am. Nishta, key question is that do all transgenders, this is a question, audience question asked, and I'm reading it as it is. Do all transgenders face gender dysphoria or is it limited to the intersex group?
Well, dysphoria is not a word anymore. It is
Right,
replaced with incongruence.
it's correct.
Most of the transgenders, yes, transgender people, we do face incongruence, and it is not just the transgender folks, but also intersex folks who experience intersex. With the gender affirmative surgical interventions, a lot of parents happen to get the surgical interventions done for young or rather babies who identify themselves as intersex, which becomes problematic for them for the future survival. There are a lot of hormones which plays major role in our body, and it is up to the person to decide in their growing ages to decide whether which binary they want to choose, or if they don't want to choose any binary, if they want to identify themselves as a transgender person, it has to be allowed. Unfortunately, our society was not very well equipped with this. Hence, there have been a lot of difficult situations that trans folks as well as intersex person had to face. Now that a lot of people are keeping ourselves informed, and with sessions like these, uh, psychiatrists are taking interest to know more about the transgender community and the intersex community. I have been through interactions with the doctors where they've said, I have not been exposed to a transgender body. Never in my anatomy lectures I was shown a transgender body. How does it look? Well, it was a shock for me. It is not a transgender body, but what she was trying to refer was an intersex body. So I could connect the dots and understand that what the doctor was trying to tell me was about an intersex body. That's where, I could help her understand about the queer terminologies and the difference between a transgender person and an intersex person. But yes, incongruence is very common and most of us experience it.
Right. Well, Pallav, question for you is, what do you think are the few innovative programs we need to do for the future to help members of the community from a mental health perspective?
Reach out to politicians and
Right.
start talking about policy changes and not just panel discussions. We need that's when
Right.
society will change.
Sure, sure. Yeah. Well, question for you, Prasad, is since you've been doing this whole coaching program, one is how important do you think is resilience building from your end, in this whole area, and particularly for a post-COVID era, what do you think you would suggest?
So resilience building is important for all of us, irrespective of our gender and sexuality and gender expression, and especially for the LGBT community because there is a lot of minority stress that is being pulled on to them. The question is, how do you build that resilience when from a very young age, from a maybe even an adolescent age, you are told that you're not enough, you are a loser, you are abnormal. How do you build that resilience? And I think as many of the panelists expressed, that the society needs to change. And I want to just bring to everyone's notice that this is society. We are a part of society. So, what are the steps that each of us are taking to make that difference, to make that change is very important. It is very easy for us to say society should change, people should build resilience. The question is, what are you doing for that to happen? What are you doing for yourself and what are you doing for others? If you are able to help even one person to build that resilience through your unconditional acceptance of that person, you have changed the society.
Right.
So, directing those questions to yourself rather than to others is, I think, the first step towards changing the society.
Yeah. My last question to you, Cheryl, and then after that, I have something for the entire panel that I want to share. One is, do you think that we become so much online now in this COVID era, and the fact that mental health services are available online? Do you think it has made more members of the community access mental health services?
Definitely, definitely. So, pre-COVID era, pre-online consultation, to have somebody come to a psychiatric OPD, forget from whichever community they belong to, is itself a challenge because it's a stigma, right? You're getting into a hospital. There, sometimes I have families say, okay, can you just remove the name of psychiatrist outside your clinic so they can just come in. So stigma to seek mental health help is there anyway. With the LGBT community, it's even more because they anyway feel discriminated against, they feel victimized. With online consultations, I've had people from remote parts. I had so many clients from Rajasthan, from Raipur, who have felt that this is a great opportunity to connect to somebody who's understanding their problem. Like we all know, we spoke about this about a lot of mental professionals who do not are not aware about the different terminologies. They cannot be affirmative or guide somebody who's struggling. So the access to somebody who can understand their problem has really increased. They can have the privacy of having the discussion. You can step out into the garden and have an online consultation, so you're not kind of restricted by space. And so it's really a boon for people seeking out mental health, and for the LGBT community, definitely a big boon. And we are able to really guide them through so many of their problems.
Yeah. Well, I think one thing which I want to probably ask of this panel is that, of course, I totally agree with Pallav that we need to work at a policy level. But beyond that, I mean, I would want one of the things is that this panel gets back maybe in August and we do one exclusively in Hindi, as been, advised. So that's one. I will get back to you for that. Another thing that I would want to do is that, I would request Prasad with HPQI and Jyoti ma'am, if Pune Psychiatric Society could join in with us, and we could come out with maybe a small booklet on terminology and do's and don'ts for mental health professionals and everyone. When you encounter someone who belongs to the community, just basic social skills, what you should say, not say, what you should do. This could be a manual that could be at a psychologist table, it could be at the workplace, it could be at a CEO's table, it could be anywhere, just so that I'm sure there must be manuals already there, I'm not saying that they aren't, but something we could develop comprehensively based on our expertise. And I think if Bombay Psychiatric Society and Pune Psychiatric Society together take the lead, I always feel Bombay and Pune are two cousins who are joined by Lonavala in between. So the thing is, if we can take the lead and definitely do it, I think it'll be something which will be never done before, at least from on an Indian psychiatric platform. So I would definitely want to take this forward. We will get back to you, all of you, on email, and try and see how we can take this forward. uh, I want to thank each one of you for taking time out on a Sunday evening to be on this panel. It's been a wonderful panel. Pallav and Nishta, I'm meeting you for the first time, but it's definitely not the last time. I'll be meeting you again and again. Prasad, of course, you're always there. Cheryl and Jyoti ma'am are just a phone call away, so that's never the thing. So with this note, I thank everyone who have been with us. We've had nearly up to around 95 people who have joined the panel. The recording will be on the YouTube channel. We'll send each one of you the links so that you can circulate it. We haven't addressed everything. We've tried to address whatever we could. There's always so much to address. And with that end, I want to thank you. God bless each one of you and all the best.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you, everyone.
Yeah.
Thank you, everyone.
Thank you.